Hi everyone, we're going to talk about diaper dermatitis today. I chose to do diaper dermatitis as my promotion project due to a recent increase in cases on the unit. So we're going to be going over some re-education as well as introducing some new products that we have come across based on some new evidence that we have found. Okay, so first I'm going to talk about wiping. If you have a patient that is less than 34 weeks, for the first 2 weeks of life, you're going to use sterile water combined with the dry wipes. After the 2 weeks, if the skin seems okay, then you can go on and use the regular Pampers diaper wipes. If your patient is greater than 34 weeks, for the first 1 week of life, it is recommended that you do use also the sterile water with the dry wipes. And after the first week, if everything seems okay, you can use the regular Pampers wipes. Be sure that it's the sterile water and not the sterile normal saline wipes, as the sodium in the normal saline wipes is not good for the newborn skin. Okay, next we're just going to do a quick review on the products that we use. So in prevention of diaper dermatitis, we have Alavesta, and that is to be used on the skin that does not have redness. If the skin does have redness, that's when you would start to use the Sensi-Care. And then if the skin has some breakdown, that's when you would go on and use the Triple Care, which we're going to go over the proper way to apply the Triple Care. Okay, now we're going to go over the proper steps to apply the Triple Care. First, you're going to be sure that the skin is nice and clean. In order to clean the skin, you will use the sterile water and dry wipes. If there is Sensi-Care on the skin, you will use Alavesta in order to remove the Sensi-Care. So once the skin is clean, you will take your stoma powder and gently put it over the affected area, wiping away any excess powder. The next step is using the Cavalon. You will gently dab the Cavalon over the stoma powder in order to seal the stoma powder properly. That will take about 30 seconds and up to a minute to dry. Once that is fully dry, you will take a thin layer of the Sensi-Care and rub it over the affected area. Just like that. And then you can close up the diaper. In between diaper changes, if the patient did stool, you can do your best to remove the top layer and then reapply the Sensi-Care again. If the area that you removed is the open area, then you'll do the whole Triple Care process from the start again. And just to go over, when removing the Sensi-Care, it's best to do it with the Alavesta. So you're going to place some Alavesta on a dry wipe, and in a dabbing motion, you're going to gently go over the skin. And as you can see, it very easily removes the Sensi-Care from the baby's skin. If the diaper dermatitis is not improving, there are several things you can consider. First, you want to talk with the team and talk about the frequency of diaper changing. Should you be changing the diaper more frequently, as a dry and clean diaper does help to improve diaper dermatitis. Next, you want to talk about the stooling patterns of the baby. How frequently they're stooling. Is it liquid? Is it hard? The consistency of the stool, and what can be done to improve the stool consistency, whether that be medication alterations or diet alterations. And lastly, you can definitely consider consulting wound to take a look at the patient's skin. And if your patient's diaper dermatitis is not improving, a new product that we are now using is the Cavalon Advanced. You can get this through Wound and Ostomy or talking to Sam or Krista about it. Now we're going to talk about how to properly apply the Cavalon Advanced. The Cavalon Advanced comes in an applicator just like this. So you're going to start out with a clean bottom of the baby. It will be helpful to have a second nurse helping you in order to keep the affected area open. So you'll hold the applicator, you'll pull the lever, and then point it downward in order for the liquid to absorb fully into the sponge. Once it is absorbed, then you will, in a wiping motion, gently wipe the affected area, like so, and then holding the affected area open for approximately 30 seconds to a minute to allow it to fully dry. You will then close up the diaper. Avalon Advanced is used one time between 48 and 72 hours. After that period of time, the skin will be reassessed. Hopefully we'll see some improvement. And during the 48 to 72 hours, you can only use sterile water and dry wipes when cleaning the baby's bottom. That's all I have. Thank you for watching.